My name is Josie, and this is my friend Normie. And today we're going to be talking about social determinants of health. The social determinants of health. The primary factors that shape health of Canadians are not medical treatments or lifestyle choices, but rather living conditions they experience. These conditions have come to be known as the social determinants of health. Based on decades of research and hundreds of studies in Canada and elsewhere, this information is unfamiliar to most Canadians. Canadians are largely unaware that our health is shaped by how income and wealth is distributed, whether or not we are employed, and if so, the working conditions we experience. Our health is also determined by the health and social services we receive, and our ability to obtain quality education, food, and housing, among other factors. And contrary to the assumption that Canadians have personal control over these factors, in most cases, these living conditions are for the better or worse. They're imposed upon us by the quality of the communities, housing situations, work settings, health and social services agencies, and educational institutions with which we interact. The primary factors that what is social determinants of health? Social determinants of health refers to a specific group of social economic factors with a broader determinants of health. These relate to an individual's place in society. Experience of discrimination, racism, and historical trauma are important social determinants of health for certain groups, such as Indigenous people, the LGBTQ community, and Black Canadians. Determinants of health is the broad range of personal, social, economic, and environmental factors that determine individual and population health. The main determinants of health include income and social status, employment and working conditions, education and literacy, childhood experiences, physical environments, social support and coping skills, healthy behaviors, access to health services, biology and genetic endowment, gender, culture, race, and racism. Research shows that social determinants can be more important than healthcare or lifestyle choices influencing health. For example, numerous studies suggest that social determinants of health account for between 30 to 55% of health outcomes. In addition, estimates shows that the contribution of sectors outside health to population health outcomes exceed the contribution from the health sector. Addressing SDH appropriately is fundamental for improving health and reducing long-standing inequities in health, which requires action by all sectors and civil society. Research Where do the social determinants of health originate from? The Commission of Social Determinants of Health was established by WHO in March 2005 to support countries and global health partners in addressing the social factors leading to ill health and health inequities. The Commission aimed to draw the attention of governments and society to the social determinants of health and in creating better social conditions for health, particularly among the most vulnerable people. Why is addressing the role of social determinants of health important? Addressing social determinants of health is a primary approach to achieving health equity. Health equity is when everyone has the opportunity to attain their full health potential and no one is disadvantaged from achieving this potential because of their social position or socially determined circumstance. Health equity has also been defined as the absence of systematic disparities in health between and within social groups that have different levels of underlying social advantage or disadvantages, that is, different positions in social hierarchy. Social determinants of health such as poverty, unequal access to healthcare, lack of education, stigma, and racism are underlying contributing factors of health inequities.
Rebecca, a 45-year-old lawyer, is a working mother who lives with her husband and two children in their home in Oakville, a suburb of Toronto. Charlotte, a 43-year-old working mom of two, lives in Toronto. She and her husband got a divorce a few years ago, leaving her to raise the children alone. Charlotte works 2 shifts in 2 restaurants in order to pay rent and make ends meet. Each year, Cancer Care Ontario, or CCO, sends out cervical cancer screening letters to remind women in Ontario to have their pap smears done. When Rebecca gets the reminder letter, she books an appointment and stops by her family doctor to get the test done before heading to her office. Charlotte also gets the same letter. She reads it and decides to wait another year because she'll have to lose pay if she takes time off. The same thing happens year after year. 5 years later. This year, Rebecca went to her doctor after receiving the screening letter, just as she's done before, except that this time, she found out she had cancer. She was treated immediately. In a few months, she became cancer-free. "Thank goodness, we caught that early," she said, thanking her doctor. Charlotte, on the other hand, went to the doctor because of pelvic pain and blood in her urine. She was given the news that she has metastatic cervical cancer. What do you think accounts for the different fate of these 2 women? In this module, you will learn more about social determinants of health, or how circumstances in which people are born, grow, live, work, and age influence their health.